Well, depression is one of the most common mental disorders. In fact, it's a disorder that is not only important when compared with other mental disorders, but it's also a disorder that causes a huge amount of disability and when compared with other disorders. It's in fact estimated by the World Health Organization that by 2020, depression will be the second disorder in importance in terms of causing disability. So it's a huge public health problem that is caused by depression, quite apart from the suffering of people who have it. We do have criteria for the symptoms that need to be present if you want to call somebody, given the diagnosis of depression. And if these criteria are used, then depression is in fact clearly a condition which needs medical help and which is equal to any other disease that you might name.
I think depression gets mixed up with feeling low on an off day or an off couple of days, and that is not depression. That may be depressed mood, but that's not what we would call depression. We reserve the term depression for those with moderate or severe illness with the full panoply of depressive symptoms that we use to recognize depression. And in those people, it's under no circumstances a trivial or made-up illness.
The symptoms of depression taken alone are things that we all experience at some stage of our life. Difficulty of sleep, difficulty we don't have any appetite, or maybe irritability or fatigue or losing interest in things. All of this can happen alone to anybody. But when these problems are appearing together and stay on for a longer time, you have to start thinking that perhaps there is something else that is behind it, for example, depression. Depression will also lead to a change in the level of functioning of a person in society, for example, in the upbringing of children, or at work, or in various other social roles that one has to perform. All of these seem to suffer, and it's really the accumulation of signs which makes us suspect that depression is present. It's lesser functioning in normal social roles, it's lesser feeling of joy in life, loss of interest in things, irritability, physical problems such as loss of sleep or loss of appetite.
Within the family environment, what you will notice is that the patient is being less careful with their appearance. They may well not be assisting so much with the family. They don't sit with the family as much. They don't interact with the family. They may be sloppy at doing some of the things about which they were previously meticulous. In other words, their dress may deteriorate a little bit. They're less careful with combing their hair, with hygiene, these types of things. There's a sort of functional change in the patient. And all of that associated with real sadness. They may occasionally be caught crying or something like that. Things like that, which persist for more than a week or 2 weeks, are very, very important, and the family should therefore encourage the patient to attend to the doctor for treatment.
Most people with depression are afraid of going to see a doctor. They have ill-defined fears, not knowing what's there, what's wrong with them. And it's very hard for them to recognize that this is an easily treatable illness and one that should be treated fast.
If the family and friends are aware of what the symptoms of depression are and what kind of changes might happen, they may in fact draw attention to the individual that he might need support or help, and they might also try to bring him to treatment and try to provide him with support in his daily life.
We need to start pressuring the whole society to recognize depression and to persuade those with depression to come forward, and we need to persuade doctors not to ignore it when it arrives. and we need to ask them to ask questions about depression of those who come along with, say, sleep disturbance, or those who come along with poor concentration, those who come along with the cardinal features of depression. They should investigate further to see whether they have depression.
There is a need of the clinicians, of the health professionals, to help the general population to understand what depression is, to understand the functional consequences of depression, and to help them to make the difference between normal mood variations that everybody may feel. So there is an education of the population, an education of everyone to recognize also that it is a pathological state. It is not transient. It is not only reactive to a loss, only reactive to life events. So there is really a need to for this education of people, patients at first, but also all surrounding people of the patient.